switching it back.
Oh, not bad.
It's okay.
Oh, yeah, it's really bad.
Hello, everybody. I am live with you guys. We're going to be talking about herniated discs today. I'm going to be giving you the 10 best exercises to help avoid surgery and heal a herniated disc. Who is watching right now? Guys, can you let me know if you can hear me? That way I can know that my mic's working here, and hopefully you can see me as well. Obviously, you should be able to see me. Y'all leave a comment on here. Let me know. We're live on Facebook, on YouTube, and we should be going on Instagram. I think I turned it on. Yep, we're going on Instagram. Who is out there watching us live? We're talking about disc herniations and back pain. Okay, we got some comments coming in. Fantastic. RV2 Heaven 877. I can't hear you. Oh no. In Tesla, Maryland. Okay, but Mark Alexander says sound is great. Okay, so we're coming in for Mark, but not for RV2 Heaven. Anybody else out there? Comment if you can hear me. I put the ticker on the bottom there. Music says Big Island of Hawaii. Oh, Hawaii. I'm so jealous you live in Hawaii. That's awesome. Slow Poke JM says good here. Okay, we got some more. D1 Blevins says I can hear you very well. Bobby says he's in New York. Awesome. Yes, I got a notification on live before it was over. Okay. And then our team says we can hear you. All right, fantastic. Thank you guys for letting me know. Let's get into this. Let's talk about disc herniations and back pain. So here is the title. I don't know if you can see this, but I'll read it to you. It says the 10 best exercises to avoid surgery and heal a herniated disc. And let me give you number one, and then we're going to show you how to do this. This is lower abdominal, sorry, I misspelled it a little bit, activation. Kind of a lot to write down here, but very, 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 very important. And I'll show you what I mean by this and why. Let me just get into the exercise. Let me show you how to do this. All right, so lower abdominal activation. You're lying down on your back. You have to find somewhere to lie down. And if you think about your abdominals here, it's from your rib cage. That's the top of the abdominals. And it goes down to the pelvis bones right above your private area. All that is abdominal muscles. If you point to where your belly button is or should be, that's your halfway point between the upper and the lower. So everything below the belly button is your lower abdominals, and that's what we're focusing on here. Most people, I can't say that I've ever had anybody, now that I think of it, who has a back problem like a herniated disc, who they all cannot fire the lower abs. They all can fire their upper abs very well, but not their lower abs. And so that's what I'm teaching them, is how to fire your lower abs, because you need your lower abs to support the lower spine where the discs tend to get herniated, because most disc herniations happen in the two lowest discs. I'll show you on the spine before we're done today. But here's how you activate it. Lying flat, it helps if you bend your knees. Put your feet down like this. And then you think about flattening your back down into the surface that you're on. And it might help you to put your hand under your back. And you want to put it right above your tailbone. So my tailbone's right here. And then my tailbone ends about right here, usually around like where your the waist of your pants are, the top of your pants are. Depends on your clothes, of course. I'll put my hand flat. Doesn't matter if it's this way or this way. And then I'm thinking about smashing my back down into my hand right above the tailbone and hold it there and then concentrate. This is the key part, is you have to think and connect your brain to what's going on down here. And you're trying to make your lower abs work harder than anything else. You might feel your upper abs work. You probably will. And you might actually even feel your butt muscles work, which is actually fine. But you should feel your lower abdominals engage the most. And if you're trying this out and you don't feel it, it's okay. Most people, when they're first trying this out, they're confused. They're trying to wrap their head around the whole thing. It's a new thing, and they're not used to firing these muscles because they've fallen asleep. It's part of an imbalance, which I'll explain more in depth here in a minute, that leads to the herniated disc problem. And we need to fix it from the root problem, which this is it right here. Lower abdominals don't activate, and you need to make them activate in order to fix this problem. You could avoid a whole surgery. People get disc herniation surgery, a discectomy procedure, and never learn to do this. And if they just learn to do this, I bet we could cut down the rates dramatically. Probably just a fraction of those people actually need surgery if we just figured this part out and got stronger in the lower abdominals. All right, so flatten out the back, and then what I want you to do is hold it. And if you have trouble doing this, what I tell people is arc your back, because most people know how to do that. They can, for some reason, figure that one out, and then do the opposite where you flatten your back. Other words that I'll use is stick your butt out and then tuck your butt in. And it's this motion right here that you have to kind of figure out. In physical therapy, we call it a posterior pelvic tilt. So this is an anterior pelvic tilt and then a posterior pelvic tilt. It's the posterior pelvic tilt that I'm wanting you to focus on, because that gets your lower abs to work. It's pulling the front side of your pelvis bones here up towards your head, and your abs are in the best position to yank it up, to pull up right here. But I need you to get your lower abs to work. Don't think about bringing your rib cage down, that's upper abs. Think about bringing your pelvis this way, anterior tilted this way towards your head. Holding for 10 seconds is a big deal. You can hold it right there. And then once you figure out how to do this lying down, you need to figure out how to do it sitting. And it looks weird. It looks like you're having bad posture, because if you see me from the side view here, I'm sticking out my butt, and then I can tuck it in and it looks slouched, but I'm actually engaging my lower abs here. Posture is not something I want you to focus on. And I'm kind of countercultural with that, because a lot of people say you need to focus on having good posture. And I always get into debates with healthcare professionals over what is good posture and why. Because everybody has this idea of posture makes you taller and all that. And I get it. What they're regurgitating to me is that posture needs to look a certain way. But what I come back at people about with posture is what muscles are helping you get there, and are those muscles firing good for your overall spine health or not? And in most cases, being all erect, sticking out your chest, being nice and tall, what people would say is good posture actually causes you worse disc problems. So I want you to instead do this and get those lower abs to fire. Hold it for 10 seconds. The reason why for the 10 seconds is because, especially if you don't have good muscle activation in those lower abs, you're getting a better nerve connection to the muscle by holding it for longer, because you're sending a more continuous nerve signal down to the muscles that you need to work, and you're waking up all those dormant muscle cells that haven't been doing their job to put the proper pressures in your spine and unherniate your disc, or take the pressure off and allow your disc to heal. Then after you do it seated, you've learned it lying down, then you need to learn how to do it standing up. So if you look at my side view here, you can see my lower back. A lot of people will stick out their back like this. That's arcing your back, or an anterior pelvic tilt. We need to do a posterior pelvic tilt, which is tucking your hips under your spine, shoving your hips a little forward, and it gets those lower abs to activate. So lower abdominal activation, that is number one. And I spent kind of a lot of time on that on purpose, because it is that important. You need to figure out how to activate your lower abs in order to heal a herniated disc. It takes pressures off the spine almost instantly. And if you figure this out and you get the pressures right and you get the muscle to activate, I consistently have patients tell me in person, the ones that I see in person, I instantly feel better. And then the ones that, especially the ones that are trying to have good posture, they're trying to stand nice and tall, sit nice and tall, they say it kind of hurts after a while to do that. And I'm like, yeah, because you're firing your back muscles, adding compression to your poor herniated disc. And you're trying to do good by people telling you to have good posture and that's going to help your back. But it's actually bad for you. You need to get your lower abs to fire and sacrifice the good posture. Who cares? It's not going to help you right now, because your body tells you feel better when you just do this posterior pelvic tilt and get into slightly bad posture. I'm not asking you to hunch over and have extremely bad posture. I just want you to tilt your pelvis, get your lower abs to activate. That's really what I'm saying. I'm not saying assume bad posture. So get it straight in your head, get the mechanics of this correct, and you're going to be in a much better place. This by itself can probably fix 60 to 80% of back problems out there without the rest of this list. Right there, we can just end this video right now, and you're probably going to prevent surgery and healing your back. 80% of you guys, 60 to 80% of you guys. But I got more. Let's go on to the next one. Let's talk ab bracing now. So it's kind of the next level. And particularly, we're going to do it in seated. Let me show you what this looks like. So, I told you to tilt your pelvis back, get into that not so great posture, but really it's a focus on getting your abs in. Once you've mastered how to activate your abs, then what needs to happen is you have to develop a habit of sucking in your abs from the lower abs slightly. If we talk percentages, like 0 to 100%, you've probably been doing 0 or near 0 for a long time. And because of that, your abs that connect to your back, which three out of the 4 ab muscles that you have directly influence your back. And I would even argue the 4th one indirectly influences your back. You're not getting the support from those abs on a consistent basis every day whenever you sit, walk, do everything you need to do. And if you just tell yourself, I'm going to brace my abs in seated, you just suck in your abs, and from the lower part, you should feel your lower abs working. Now that you've practiced it, you should feel like you can do it on command. And sit like this for as long as you can tolerate. It takes a little bit of time to work up your tolerance to being able to hold it for 30 seconds, a minute. But what I'm asking you to do is not 100% contraction, because that would mean I'm out of breath and my stomach is tight as if somebody's going to hit me. I'm like bracing for a hit. We're not talking that intensity. I'm talking about like 10, 20% of that. It should be light, but you should feel like you're working a bit. And it might take a lot of mental effort at the beginning, but as you practice this and practice this, what you're doing is adding more time with your discs in your spine offloaded. If you don't do this, by default, your body has to stay upright somehow. It's fighting gravity. I'm sitting here and I'm not falling over. And if I'm not using my abs, if my abs are just hanging out, then by default, I'm using my back muscles. And when you use those back muscles, the ones that are right on the sides of the spine, on the back of my spine, they're going to add compression to the spine. But when I get my lower abs involved and I bring my rib cage down like this, I get in that little slouch, that bad position posture, I take pressure off my back. Because can you see how that little hunch right there, it just takes pressure off my back. It relaxes the back muscles. A lot of you guys might have back spasms in addition to your disc herniation. That's because your back muscles are being used too much, because they're saying, I don't have any help from the abs. I got to work all day. And they get overworked and they start to spasm. And that's when you bend over to pick up that sock or lean over to tie your shoe or something. And all of a sudden, and your back just says, I can't handle it. I can't even handle bending over because I'm so overworked. But all of a sudden you get those abs working and then you can bend over just fine. It's no big deal, but you have to be bracing. So this second exercise, just to be clear, you're sucking in your abs and holding it for extended periods of time at 10 to 20%. And you're trying to go throughout the day like this. Okay, that's the second one. Third exercise is the build up to that. So you see how these all build up? Lower abdominal activation. Some people will spend, let me just write this somewhere, because this is important for you guys to know. Some people will spend 1 to 3 months doing this. A few people will knock this out in like a day or two. But the majority of people will be dealing with figuring out how to get their lower abdominals to activate for 1 to 3 months. I challenge you to go faster. And it's really just a reps thing. Most people that go fast, they just get obsessed with it. They just say, I'm going to do this constantly throughout the day until I figure this out. And they figure it out pretty quick. They'll figure it out within days. And then you got to start doing it sitting. And then we have to start doing ab bracing in standing. I'm just going to write stand. And then with all standing activities in walking as well. So I'm standing right now, and I did that posterior pelvic tilt a second ago where I'm tilting my hips back this way and I'm flattening my back. And most importantly, I'm engaging my lower abdominals. I'm flexing or tightening my lower abdominals. And that causes my abs to pull forward a little bit and hoist up my spine, which takes pressure off my spine. But if you're just doing it for 10 seconds at a time, great, that's a start. That's to activate the muscles, to wake them up. Now you've got to build endurance in these muscles so that when you're walking to the grocery store, when you're standing to do the dishes at home, when you're just having to be idle or standing, doing something standing, you can still help your disc. You need to be taking pressure off the disc. So the goal here in this third exercise is ab bracing from the lower abs below the belly button, just a 10 to 20% activation constantly throughout the day. Constantly throughout the day. So you might need to set a timer on your watch or a timer on your phone or kitchen timer or some sort of, call your Alexa and say, hey, Alexa, 30-minute timer. And every time it goes off every 30 minutes, you have to think, okay, suck it in, lower abs, good. These muscles are on. Continue with your day doing whatever you're doing, but with your abs turned on. That's the switch here that needs to flip. You can kind of combine all these first three, but I spread them out for you because I need you to see how important it is to fire the lower abs. Now, let me show you on the skeleton what I'm talking about here with the muscle imbalance. Very, very important for you guys to understand because I've described it, but I need you guys to get a visual of this. Let's move this arm out of the way. And let's look at the spine here. Can you see yeah, you can see it here. So here, this red thing is an example of a herniated disc. Here's the lower back right here. This is the front of the body facing me. Back of the body's on this side over here where my hand is. And if you think about the muscle imbalance, you have all these muscles on the back of your spine. They directly connect to all these bones right here. And they're in a really good position to, when they activate a lot, when they're the dominant muscle providing stability, when you don't have anything going on in your abs or very little going on in your abs, these muscles will get strong and thick. And when they get strong and thick, just like if you were to go lift weights with your arms or with your legs, your leg or arm muscles will get strong and thick. And it adds compression because you get this thing called increased resting tension. It's what gives you tone. When you're not toned because you haven't been working out, your muscles are flabby, but then you start to work out for a couple of weeks. And if you keep going, your muscles get firm and you get more toned. Well, if you consistently work out, you're going to have very hard, firm muscles. And those of you guys that have disc herniations, especially if you've had a history of back spasms, you're probably going to have very toned, hard muscles back here, extremely toned, and flabby on the front. That's the imbalance. So these ab muscles on the front, they need to be pulling the pelvis this way, because when you do that posterior pelvic tilt, it just draws the bottom part of the spine down a bit, and then it pulls the rib cage down slightly. So it's bringing this down and the pelvis up, and it's unweighting my back. It's taking pressure off the back, and it's signaling to the back muscles, you can take a break. You don't have to do all the work. It's allowing them to work in balance. It takes a process to develop the strength necessary in the abdominals to do this consistently. And this is why I need you to do this bracing constantly while you're sitting, while you're standing. Practice it lying down even. I'll tell you how obsessive you need to get with this. I used to go to school in Austin. I'm in El Paso right now. That's where we're located. If you know that drive, it's 8-9 hours of just driving, boring. There's not much to see. You see mile markers on the side of the road. I would sit in the car and suck in my abs when I figured this stuff out, and I would try to hold it for as many mile markers as I could. After I started doing this, there would be days, the day after I complete the drive, where I was so sore in my abs, especially my lower abs, it felt like I did 1,000 sit-ups a day before, and I was sitting in the car driving for hours, just trying to hold my abs in. And you know what? My back pain went away. I had tiny bits of back pain here and there, completely went away. And I felt great ever since then. The times where I've had flare-ups and back pain has been when I've trailed it down on my lower abdominal exercising. That's doing it for a lot of people out there. They just don't get their abs. And when they're trying to work out their abs, they miss the lower abs and they get the upper abs and they're telling themselves, I am working out my abs. And you are, if that's you, except it's not correcting the imbalance because you're only doing half the formula here. You need upper abs and lower abs. Most people are decently strong in upper abs and they're very weak in the lower abs. And if you have a disc herniation in one of these lower levels right here, the ab muscles that are down here below the belly button, they tend to provide the most stability to the lower part of the spine, the L3, L4, L5 area. And so if that's where you have your disc herniations, it's probably because you don't have good support from these muscles down here. So you've got to get these lower abdominal muscles. Hopefully I've driven the point home on how important these lower abdominal muscles are. It's not stretching out your back. It's not exercising your back muscles. You don't want to do that. That's going to make things worse. In fact, a lot of people say, I should be exercising my back muscles. A lot of healthcare providers out there are telling people to exercise their back muscles. They're telling them to work out these muscles, and they're already overworked. Why work them out more? You're just putting yourself into further imbalance, adding more compression to your spine, and further herniating the disc. We don't need that. Stop exercising your back muscles. Focus completely on the abdominal muscles. And then the in-between people will say, work it all out, work out abs and back. And to that I say, no, you're already in the extreme of having very strong back muscles and very weak abdominal muscles. So you're like this, strong in the back, weak in the abs. If you work them both out, you're just going to still be in balance, just stronger overall in both. It's just going to add more compression to your disc. What we need to do is this. Bring your abs up to the right balance with your back muscles, which is going to take you months. So you have no business doing back exercises for a long time, maybe a year or two. All right, let's move on to the next one. Let's get off of abs for a second. Glute activation. Glutes activation. They work with abs very, very closely. And so if you can get your glutes to work at the same time that your lower abs work, you're on the right track. And so here's how I want you to do glute activation. Just make sure I'm on the right notes here. Yep. So lie down on your back. Knocking down our equipment here. Put your legs flat. That's my recommendation. And then do the back flattening maneuver, the same thing that we did to get your lower abs to activate. And with your legs, with your back flat and your abs activated, then think about tightening your glutes. You have to consciously make an effort to flatten the back to get the abs going and then get the glutes to activate and think to try to make the legs relax. The point of this exercise, of this glute activation, is to have you realize what muscles are working out, because very often when people go to activate their glutes, they also activate their thighs, they activate their back muscles. They're so imbalanced, they're so compensated that the wrong muscles fire whenever you intend to fire the glutes or the abs. And so I need you to spend time just thinking, all right, back flat, lower abs engage, that's step one. Then step two, now consciously tighten the glutes and make your glutes work. Don't also tighten the thighs and straighten out your knees and get the back muscles to work. You just want to get the glutes. That's step one on this one. I'm going to pack them all together. Then you have to start to activate your glutes in seated. Because what if you have a desk job? What if you have to travel and sit for long periods of time? You still can do this. Get your abs going, do the little baby slouch thing that I'm talking about to get your lower abs active, then tighten the glutes. One of the funniest things that I ever saw as I was going through my training, as I was going through physical therapy school, is I sat in the back of the class at times, sometimes I sat in the front, I kind of moved around, and we all activated our glutes, and you just saw everybody's heads just go up an inch or two. But that's how I can tell people are activating their glutes, because you'll go up in your seat because the muscles get thicker and it just raises you up a bit. So you want to activate those glutes and hold it for 10 seconds, and then think, don't let my thighs take over. And see how I have my legs in different positions. You might have them a little more close together. You might have them more apart. You have to start to get good at firing your glutes in slightly different positions as you figure this out. The next part is doing it in standing. So if I'm standing, I do that tilt thing to get my lower abs to work, but simultaneously your glutes already should want to activate when you do this, because the pelvis bones right here, they get pulled up from the abs on the front side, but they also get pulled down a bit from the glutes on the back side. So they kind of work together to pull up on this end and down on this end to get your pelvis positioned properly, which then sets the foundation for the rest of your spine going up, which takes pressure off your herniated disc and allows it to heal so you can avoid surgery. Super important to get your glutes to also activate with your abs. All right, let me take a moment here to just see some comments coming through, and then I'm going to come back to this list. Oh my gosh, you guys are lighting it up here. We got music is in Si Hermanito, living in Pahoa, Hawaii. Fantastic. Hear you in Northern Ireland, town of I can't pronounce that. Majerfelt. Fantastic. That's awesome. And then we have Linda in California, Southern California. So cool. You guys are all over the place. Sorry, I can hear you. Please excuse Siri for the mistake. We had somebody have a typo. Excuse me, no problem. The Hideout One says, I can hear you. Jennifer Trella. Oh, look at your dog there. That's so cool. She's in Indiana. Kimberly's here. Hey, Kimberly. She says, good afternoon, Dr. David, and everyone watching. Kimberly's a regular here. Keto Mama 777. I think I've seen you as well, Keto Mama. So holding your stomach in is good for you. Yes, absolutely. From the lower abs, Keto Mama, you have to do the lower abs, okay? Because the upper abs thing, I feel like that's more for vanity. Most people can do that. I'm talking about those lower abs, and we're thinking about doing that little pelvic tilt that I'm talking about as well. You have to make it all come together. Glutes have to be active as well. That's the goal. You want to have a little bit of muscle activation in those muscle groups in order to keep yourself healthy long term. Who's next here? We got Lisa McNeely, 2637. Will that help with the iliolumbar ligament? Absolutely. I can go into questions after I'm done with this list here. We got Cindy Castillo. Hey, Cindy, I remember you. She's in Dallas, Texas, fellow Texan. Awesome. Help from Michigan. How's it going, Victoria? Sizzle, sir, I can't pronounce it. Sorry. She says hello. Beautiful picture there. Victoria gives a smiley face. Ann Cooper Smith says yes. She can hear us. Victoria says, whoops, I meant hello. I'm okay. I love it. Y'all are funny. Keto Mama says, when I was a kid, I always hold my stomach in. My doctor told my mom that I shouldn't be doing that. The physicians are excellent at medicines, injections. If they're surgically trained, they're surgeons, but they don't know movement very well. They don't know muscles very well. So, if you got that advice, it's okay to let it go. That's what I'm an expert in. And people do my stuff all the time and tell us they have improvements. I think it's worth it for sure to follow my advice here, of course. And yeah, doctors say things. One of them that gets me, like with back problems especially, and I'll talk more about it before we're done today, is people that have disc herniations. Doctors will say things like, you should never lift weights. And I'm like, so far from what should happen. You absolutely need to lift weights at the right time. If you're hurting right now, yeah, don't lift weights, but don't keep that rule forever indefinitely. Once you fix the problem and you get the right muscles to work, you should lift weights appropriately, right technique, right loads at the right time. You have to, do this wisely, which I'll talk to you about before we're done today. Oh, Sizzles. I can't say the Sizzle Vayam. It has donated $5. Thank you so much. I appreciate that. She says, thank you for all your help. You're welcome. Appreciate that. And then we got some more questions here. I'll come back to the questions before we're done here today. All right, let's get back to this list. I'll give you guys everything I can here. Bent knee fallouts is next. This one's really cool. I'll tell you why. Bent knee fall outs. The reason why this is important is because often with back problems, Let me just show you myself real quick. So there's hip flexor muscles that help you to pick up your knee like this. They are in the front of your hip right here. They connect directly to the vertebrae of the low back. And they run from your thigh bone down here, and they run vertically within the middle of your body, and they come up and they help you to bend your knee. When one flexes it, it shortens, and it's using your lower back bones, your lumbar vertebrae, as an anchor to then pick up your leg and use it during the walking pattern as you're swinging your leg to take a step. Because of their attachments, those psoas muscles, particularly the hip flexors, they can also provide stability to the spine. In some cases, people will get deep pain in the front of their hips that contributes to back pain, and it's sometimes because their psoas muscle is stiff and tight because it's overcompensating for those weak abdominals. Because abdominals are neighbors. Psoas and abdominals are right over each other, right next to each other. And so they can be used interchangeably to produce stability in the spine, especially because of their attachments. So what we want to do is calm the hip flexors down and make them be hip flexors, not back stabilizers. Abs should be stabilizing your back along with back muscles. But if your hip flexors are a problem, this is going to be one that's valuable for you. So lie on your back, do the back flattening thing to get your lower abs to work. Then what you're thinking about is dropping one knee out to the side as far as you can comfortably go without twisting in your body. You want to keep your back flat on the surface that you're lying on. And then once you get to the end, once you're nearing the end, you should be thinking about tightening the glutes on just that side to get your knee to go out a bit more without rolling over. All right, so let me show you that in real time. I'm gonna do it on my right. I'll kind of alternate. I usually tell people to do one side at a time. Right there, my glutes working right there. It doesn't matter if you alternate or do one side at a time. What I find is people that alternate, they tend to start to go fast and do this bit where they're twisting in their spine now. We don't want to do that. So I'll tell them just do one side like this, and that kind of avoids the twisting. But what I emphasize to people is once you get to the end right here, you have to do a little glute tightening. You don't always have to do this. Sometimes I'm after hip mobility. Like if somebody has hip arthritis, I'm not too worried about the glute firing. I want them to just move in their hip joint because we're focused on loosening up the hip joint. But in this case, with a disc herniation problem with back pain, I want you to fire the glute muscle because it signals to your hip flexor that I don't need to stabilize. I don't need to be a part of this motion. It's glutes that should be taking over here. And your abs should be working kind of the whole time. Right now, I'm going kind of fast. I would tell you to start deliberately and slowly, making sure that you're doing the motion properly without rolling in your back, like rolling over this way. And then alternate sides. And you should actually feel your butt muscle on the side that you're working on start to warm up and get a bit of a workout as you go here. But it's not an intense exercise. It's very doable. The point here, the number one point here is to teach your hip flexors to calm down and let the glutes do their job. Super important exercise. Because then the hope is that this translates into walking, into other activities that we'll do here in a second, weightlifting activities, and you're not using your hip flexors too much and causing more compression through your herniated disc. All right, let's go on to the next one here. Oh, it's a good one. I'll just try it here. Once you get your glutes going very well, and your abs, of course, then we got to get to mini squats. And mini squats is exactly what it sounds like. You're just doing a mini squat, but the key parts to factor in here, to think about, is I'm going to show you the side view, I'll show you the front view and the back view here in a second, is you have to think about the abs, getting those lower abs to activate by doing that posterior pelvic tilt, takes pressure off the spine back here, and then think about tightening the glutes back here, because that pulls the pelvis down from the back. So you're getting the best stability and position for your pelvis, which then sets up your spine, your lower discs in your spine to have the pressure taken off. And then you're just going to do a little dip. See how I'm just subtly bending my knees. I'm not doing an all-out squat. I'm just doing a little tiny mini squat, hence the name. Another way of putting it is I'm just unlocking my knees. And then I'm holding right here. And I like to do the 10-second holds because that allows me to get the nerve signal to the muscles, glutes and abs, and teach my muscles to work properly in this position. Let me show you the front view now. So I set my abs in, get my glutes working in the back, and just unlock my knees. And I'm thinking about pushing my knees out because that tends to fire my glutes better. Doesn't have to look exactly like me. Some people will look more straight, but they feel their glutes working pretty good. That's what matters. Some people, especially women, they tend to be more flexible. They'll get really wide with their legs, almost like their feet fully turned out. As long as you feel your glutes, that's what I care most about. I feel it pretty good right here. And you could go lower as long as you're not hurting anything. Most importantly, let me show you my back. I'm not squatting in such a way where I'm sticking out my rear. As soon as you do this, your glutes are gone. And now you're using your back muscles and you're starting to use your quads a lot. Glutes aren't active anymore. But when you tuck your hips under your spine, you force glutes to work. And now you're getting the lower abs to work. Back muscles shouldn't be working much here. And quads might start to work as you go lower, but it should still be heavy on the glutes. And you should still feel like your abs are working pretty well. And as you get better at this over time, you'll probably be able to go into a fairly deep squat while staying upright. A lot of people, they get to here and they start feeling like they're going to fall backwards. And the reason why you fall backwards is because you're used to using your back muscles to stabilize yourself throughout the squat, not your glutes. And so your back muscles start to kick in when you're right here and they want to extend your spine this way. And so you lose your balance going backwards. That's why you can't do a deep squat, and you have to squat sticking your rear out because that's where your back can hold you up best. But it's not proper for you, and it's adding more compression to your spine, thus herniating your disc. So the way I would want you to proceed in mini squats is get in the right position, do a little baby squat, abs and glutes, of course, working. Hold it for 10 seconds. Get good at this. Gradually work into deeper squats, but make sure you're still using your glutes and abs mostly. And I would work on getting in anywhere from 10 reps, holding for 10 seconds, all the way up to 100 reps over time, and work on a little bit of depth, although it's not critical to go deeper. I have people that never go deep. They stay very shallow in that squat, and they progress just fine. They end up getting completely better, no problem in their spine. People with like arthritis problems, stenosis problems in their spine, along with herniated discs, degenerative disc disease, and they're just fine going into a little baby squat, a mini squat, not ever going deep. All right, I'll start number 7 here, but let me just take a quick moment here to tell you about something important that I think is so cool. We just released a program today called the Back Pain Recovery Program. This program is an online program where I've got my entire treatment approach all laid out, very organized, and it's got the curriculum, like videos of me teaching you. These are videos that you can't find on YouTube. They're exclusive to the program. It's also got a private community of other people that are on the same goal. The goal of the back pain program is to avoid surgery, get back to being healthy and active again, and get all the way back to where you can lift weights if it's right for you. I have specific tracks in this program for herniated discs, stenosis, back arthritis, like facet arthropathy, sciatica, and many others. I have 8 tracks in total. And then in addition to the curriculum, the videos of me teaching you this whole process, and the private community, we also have weekly live group coaching calls with me and my team. So I'll be on there this Thursday doing the very first one. We just opened up today. So if you go to our website, epmanualphysicaltherapy.com, you'll see on the homepage there a way to get to the back pain program. And you'll be able to sign up today, and you'll have to apply because we have to screen you a little bit just to make sure that you're the right fit, that you're not in a situation where you absolutely need to go to the doctor first. And if you're a good fit for our coaching community, then we can bring you to the community. We'll do a phone call and all that. But it is awesome. And let me just show you real quick. I have off camera here. Let me just reach for it because this is part of the inside of the program. I'm just going to show you a part of it. I have the program split into phases. So this is phase 1, 2, 3, and 4. And there's certain criteria that puts you in the right phase. And I've organized this so that it's extremely clear that if you're in phase 1, you should only be doing phase 1 stuff, not anything from these phases. Once you get to a later phase, though, then you don't need to do this stuff anymore because this is too easy for you. It's not going to progress you. And you need to be doing this stuff from this phase, but not this phase. This is important because even in the healthcare field, people mix it up all the time and they start to get you to do exercises that are too advanced for you, or they keep you doing the easy exercises for way longer than you should. And so you stay stuck. This program is designed to just push you along so that you don't get stuck and you know exactly what you should be working on. And then I've tied in the principles of fixing the muscle imbalance because that's what's going to solve the problem for the long term. One more thing I want to show you here related to this program. This is the back pain process. It's kind of a heavy thing. I'll just run through it real quick for you. So here on the top, you can see ages. So you start with your 20s, and it goes by 10s all the way to your 80s. And then I have conditions over here. So we have back spasms, SI joint dysfunctions. These are all the tracks, by the way. Spondylolisthesis, sciatica. There's disc herniations. They can happen at any age, but they're more likely as you get older. And we have osteoarthritis, degenerative disc disease, and stenosis. And then the muscle imbalances here are what is constantly getting worse unless you fix it. The reason why I have this laid out like this is because it's very possible, it's going to resonate with a lot of you guys, that if you have a disc herniation, which you can get at any age, if you happen to be in your 40s, for instance, you can also get sciatica. You can also get SI joint problems. That usually happens around that age. But you're not quite likely to have osteoarthritis or degenerative disc disease just yet. However, if you made it to your 50s or 60s, then you might have osteoarthritis and degenerative disc disease. And this is important because many of you guys get MRIs. That's how you found out you had a disc herniation. And they didn't tell you you just had a disc herniation. They said you also have arthritis, you have bone spurs. And then maybe on the side, you've been having sciatica symptoms. And people get so lost and confused on, well, which should I treat first? And even the healthcare professionals are like, well, let's worry about sciatica first, then we'll come back to your disc or vice versa. And it can get so convoluted, but it's all tied together by that muscle imbalance. What I'm talking to you about here on this video, abs, weak abs, strong back muscles, weak glutes, that's your imbalance. That's the core of it. No pun intended, core muscles. But anyways, back to the list here. I was hoping to just plug that in for you guys, let you know that that's available right now. All right, so we got here next. I think I skipped one, didn't I? No, we didn't do sit-ups. Let's get sit-ups in real quick because it's pretty cool. So sorry, I'm off. Sit-ups are really important. So they're a higher level ab exercise. Let me help you with that. Where I teach them very different because they are, you need to get strong abs, obviously. That's what I'm talking about. And if you don't do sit-ups this way, it's hard to get them stronger. I'll leave you to the camera here. I have a very handy camera woman behind the camera, and she's helping me out with everything. So you'll say something in the comments, say thank you to her. She's doing such a good job keeping up with me here with all the changes. Anyways, sit-ups here. I do them this way. Let me just show you. Back flat, get the abs going. Come up, reach the feet. Notice I am not pinning my feet under anything because as soon as you do that, as soon as somebody holds down your ankles, they hold down your feet or you stick them under like a piece of equipment, furniture or something, you automatically force yourself to start using your hip flexors right here, right in the front of your hips, and you'll skip using your lower abdominals. It's a cheat. And we think it's right because the military does sit-ups like that. You might have got taught to do sit-ups like that in school where, where your legs are bent and people are holding down your legs, but it allows you to not use your hip flexors. And this is why it can cause a lot of hip pain and back pain because it feeds into the imbalance. I would rather you learn how to do sit-ups like this where you're reaching towards your feet. And every time I come up, right before I come up, I'm thinking about setting my back. And then when I'm coming down, I'm thinking about pushing my lowest part of my back down so that I'm constraining my body to be used through my lower abs. And you'll see that I'm using momentum. I'm throwing my arms up. And that's okay because I'm still constraining myself to using my lower abs. So I am working within the right muscle balance. I'm constraining myself to using the right muscles. I'm just getting a little assist to come up out of that bottom motion where it's hardest to come up. It's totally fine. If I were to get stronger, I could probably come up without using my arms momentum. But that's where I'm at right now, and it works for me. I don't have any back pain. I can pick up very heavy weights, and I feel fantastic in my back. But doing sit-ups this way is key to work up to. And if you can't do them all the way like that, if you're in a spot, by the way, I said about those phases, I don't introduce this in the program until I think it's phase 3. It's got to be phase 3 where I do it. You shouldn't be doing this if you're in phase 1 or phase 2. It's phase 3 and up that you should be doing this. So if you're in pain right now, if you're having problems in your back, you have an active, painful back problem, this isn't for you. You need to go back to the first few things that I've wrote on the list. If you're starting this one out though, and you can't go all the way to your feet, this is what you do. You just set your back, go to your thighs, go to your knees maybe. You can work your way down to your shins, maybe your ankles, and then eventually you get all the way to your feet. And it just is practice over time. And the way I use this exercise is I force myself to do sets of 20 or 30 reps of sit-ups at a time. And I'll do 100 to sometimes 200 sit-ups in one workout, because my goal is to tire out my lower abs, and I make myself feel to my lower abs. And there's times where I get to, rep 120, 140 around there, and I feel like I'm not using my lower abs as much. And if I can concentrate, I can squeak out maybe one more set using my lower abs. But if I can't use my lower abs anymore, I'm done. Even though I can force myself to continue doing the reps, compensated using other muscles, my hip flexors, my upper abs, you got to stop, because then I'm feeding an imbalance. It's not about finishing 200 reps no matter what. It's about tiring out the right muscles so that I'm putting the right pressures through my discs. All right, so that's sit-ups. Let me put this away. I'll show you the next one. It's going to be a level up. All these are progressive. They build on each other. The next one is going to be using this device. Let me just write it down for you guys. We got hanging from a pull-up bar. And I love this one because it's also traction for your spine, like a distraction for your disc. It's taking pressure off the disc. So you need to have access to a pull-up bar. We have this device here, this pull-up station, but you could get one of these that install in your doorway. If you have a gym that has something like this, you might have on a squat rack, or a pull-up station like this could be beneficial too. But what I want to tell you, if you've never done hanging before or anything like this, get to a bar that you can still touch the ground on. Like for here, I'm standing on the ground and I can reach this bar from here. The ones that are way up high that you have to jump to or get a step to, you don't want to start there, because what you're going to do at first is just hang. And if your hands aren't strong enough to hold up your body weight, you want your feet on the ground so that you're not hanging your full body weight. I'm probably hanging about 50% of my body weight here, and there's the other 50% going to my feet. And this is very tolerable for me. My hands can take this right now. It's work, but I can take it. But what I'm doing here, that's gold for your herniated disc, is I'm activating my lower abs. I'm doing that ab activation, that posterior pelvic tilt in the hanging position. So now it's the benefit of both motions. I'm using gravity to distract, take pressure off my spine, but then also engaging my lower abs. And I'm just going to hang out here. Go 10 seconds, 30 seconds, a minute or two if you can. But it's going to really depend on how strong your hands are. And as you get better at this, you can start to take more weight off. You can begin to dangle with your full body weight or just toe touch. Put a step stool or a footstool under your feet if the pull-up bar is really high. The idea is just get some hanging. It's okay if it's not your full body weight. But I think this one's gold if you can access it, for those of you guys suffering with a disc herniation. All right, number 9 here. I got front squats. We're getting into weightlifting now. Big deal. I had a patient one time who was a surgeon, and he himself had a back surgery. He had a discectomy procedure, and it was about 10 years prior to when I saw him. He was coming to me because he was having back pain, and he didn't want to have another back surgery. Older guy, I think he was in his 60s at that time, maybe approaching 70s, still working and still wanted to work for another few years at least in surgery, but his back was killing him during surgery. And the last thing you want is for your surgeon mid-surgery to, oh, my back. and not be able to finish up his job, right? Or even just be distracted with back pain. You don't want that. And so I got his back feeling better. We did the ab stuff. I had him do sit-ups. I remember he told me he was cramping in his abs from doing so many sit-ups. He was very diligent. He did a good job. We got to this point where I'm talking about this to you, where I told him, now it's time to strengthen. Your disc is good. Your disc has healed. Now you need to load your disc with a little bit of weight because you have good balance of muscles or muscle strength around your disc. You need to challenge the tissue a little bit so that it can get stronger. A principle in the body is if you challenge it appropriately, it will get stronger. Muscles do this, right? You go pick up weights, and if you challenge it appropriately over time, you get bigger muscles. Your bones do this. If you put the right forces through your bones at the right amounts, not too much too fast, your bones get more dense. Your skin does this, right? If you go do yard work with your hands, if you do it on a consistent basis, you get calloused hands. Your feet get calloused. Different parts of your skin will get calloused, and it happens all over your body, not just your hands and feet. But it's the same thing with cartilage inside your joints and even discs inside your back. How else are those world's strongest people picking up hundreds and hundreds of pounds, thousands of pounds in some cases, unless they have stronger discs in their back? But they didn't develop that overnight. It took them years, if not decades, of strength building and getting their discs to that level of strength. That's why you need to lift weights. Once you're at the right phase of healing, which in my program, it's when you're in phase 4. We do a tiny bit of it in phase 3, but in phase 4, we definitely add weights. And you know what, before I get started with this, here's what I teach with the small weights. I'll have you do front squats, just holding weights here or here. So you're just squatting down. You've already practiced some mini squats, so now you're going to go into squat reps. And I can trust that you're using your abs properly and your glutes properly, and your knees are coming out, and you're activating the right muscles and not compensating with your thighs, and not sticking your butt out every time you squat and doing more of a back squat than a proper squat using your glutes. And just adding a little bit of weight like this, you start to challenge your glutes more. And as you get comfortable with properly firing the glutes throughout a squat, because that's the main muscle that should be working, and then secondarily, you should feel your abs are bracing the whole time and nothing in your back. Maybe a little tiny burn, muscle fatigue, but no pain. You should not get any pain in your back. Eventually, you work your way up to doing a squat with a bar like this, and maybe you add some weights later on, and you're doing squats like so. Thinking about tucking in your butt, sucking in your abs right here, and maintaining the right muscles working throughout the entire lift. That will keep your back safe, and it'll safely and properly load your discs so that your discs can get stronger over time and not just weaker. If you followed that advice from the doctor a long time ago that said, don't lift anything heavy, your discs are just going to get weaker over time. You need to go through the process of fixing the imbalance, getting the right muscles to fire, and then eventually making your way up to weights so that your disc can get stronger and stronger and stronger, just like your muscles can. All right, so front squats, what I just demonstrated is what I would recommend. You can do it with a barbell, the big bar, or the dumbbells, the hand weights. And then what I had to include on this list, oops, let me write that neater. I just had to include this one because so many people are against this, but I am so for this. You need to do some deadlifts. Everybody says deadlifts hurt your back. And, that's a reason why your disc's herniated. And what I say is it's that you had imbalances and you just happen to be deadlifting incorrectly. And that's why you hurt your back. It wasn't the deadlift. It wasn't the weightlifting. It was that you have imbalances. You've been using the wrong muscles. And in deadlifts, you can go very heavy. And if you take your deadlifting to an extreme and you have the wrong muscle balance, yeah, you're going to get hurt. But the way you should be deadlifting properly is assume there's plates on the side here. So the bar is going to be about right there. You want to hold the bar right outside your knees and then shove your knees out against your forearms and hold them there because that activates your glutes. And then I'm thinking about sucking in my abs here, and this is the bottom position. Then when I come up, Stand up, just don't hit your knees with the bar. And then the up position right here, I'm thinking about shoving my hips forward and sucking in my lower abs. So just get to the right bottom position and get to the right top position every time, and you've got a good deadlift, and you can gradually add more weight and get your glutes tired as time goes on. So it should look like this in real time. Knees out at the bottom, butt tight at the top. Knees out at the bottom, glutes are active, butt tight at the top, abs are active, lower abs. Just like that. And what I would start out with, if you're just getting into this, is the bar, maybe a little bit of tiny weights on the side, and just get comfortable with the form and make sure that you're using your glutes every single time. You should be done with a set of deadlifts and say, whew, I feel it right here and my abs are working the whole time. If you have that feeling every time you do deadlifts, you're on track and your back's going to be healthy moving forward. And you're going to be loading your spine properly and allowing it to heal for the long term. And you're going to be farther and farther away from ever having surgery. Whew, I got so sweaty, guys. That does it for my list. I got to look at questions and comments here next. I'm still with you guys for a little bit longer here before I have to go today. So let me just get cleaned up. Let me start wearing workout clothes for you guys. So I'm not in my dress clothes, my professional clothes. Trying to lift weights with you guys here. All right. Let's go down the list here. See what kinds of questions we got. We got Michael Anderson, 6810. How long? Thank you. How long should we not exercise back muscles? I'd say indefinitely. I've yet to meet anybody who's so abdominal muscle dominant that it's a problem. I usually find people are just very back muscle dominant and they don't use their abs enough. But you have to start using your abs more and more and more. The society we live in, where we sit a lot, where we're not as active, especially Western cultures, it's so easy to not use your abs that if you sit at a desk job all day, and then you go home and sit, and maybe you travel and you sit for 30 minutes or an hour between, during your commute, you sit most of the day. So you need to build in a time where you're strengthening your abs. And I'm not saying, that you can't work that desk job, you can't have that long commute. That's fine. That's what you got to do to live your life, and maybe you really enjoy your job. But have a time where you work your abs out. You get those lower abs to work out. And if you can hit the gym for 30 minutes, maybe 60 minutes, and get those muscles fatigued, get the glutes fatigued, then you can continue sitting at your desk job. You can continue traveling and doing everything you want to do, but don't work your back muscles out. I would say by the time you're doing deadlifts like I was doing, you are using your back muscles, but secondarily. You are using your quads, your thigh muscles, but secondarily in the right balance with your abs. So I'm not saying never, ever, ever use your back muscles or your thigh muscles. I'm saying in the earlier phases, as you're coming through this treatment approach, this should be heavy using the weakest muscles, the lower abs in this case, and the glutes. By the time you get to this phase, you're going to start using them all fairly equally, but I would still emphasize using the weakest muscles, the abs, lower abs, and the glutes, because that's going to set you up to not fall back into an imbalance. Good question, Michael Anderson. Appreciate that. All right. Z Weird Adventures says, hi, David from Germany. Awesome. Germany's here. Thanks from Ukraine. You're welcome, Michael Anderson. Sharon Rainey says, Vancouver, Canada. Oh, awesome. Canada's here. Vancouver's here consistently. I wonder if it's you, Sharon. I'll keep an eye out. Sharon Rainey every time, but I think we have different people from Canada. The Hideout One says, wow, been doing the lower abs and glutes since I watched your hip live video. Hooray, I'll keep it up. Yeah, this same treatment approach, for the most part, most of it is very helpful for hip arthritis. Absolutely helpful. Carol Bowers says, hi from Tennessee. Awesome. Sizzle, I can't pronounce his name. You can call me Melody. Oh, Mel, that helps a lot, Melody. Thanks, Melody. Keto Mama says, okay, back to holding my stomach in. Thank you, David. You're welcome. Yeah, you got to hold it in just a little bit. And, some people get stressed out about this. I got to say this because they'll say, oh my gosh, I have to go through the rest of my life sucking in my abs.
and looking like I'm trying to hold the gut in, that kind of thing. And if you're thinking about it from vanity's sake, and that's your decision. I'm thinking about it from a medical side. I don't want you to have a herniated disc and get a surgery that you could have prevented, or the second surgery. I can't tell you how many people have one microdiscectomy, the minimally invasive surgery, and then they never fix the muscle imbalances. They never do this stuff. They end up a year or two later having another disc herniation, more back pain, and it's because the muscle imbalance is still there. You got to learn how to deal with your abs. And if you have a tendency to get disc herniations, it's critical for you. It's just like if you were diabetic, you tend to not control your sugar very well because of your diet, but you can. If you start to diet and exercise properly, you don't need any medication for diabetes, but you're susceptible and you're aware of that. Same thing with the back issues. Not everybody's predisposed to getting disc herniations, but for those of you that are, you just got to know I got to handle it, which means I have to be doing ab exercises and glute exercises on a consistent basis in order to make sure that my back problem doesn't flare up beyond what I expect it to. Ideally, nothing. And I should feel confident to pick up heavy weights, or at least some weights, and live my life without having to think about my back all the time. So good comment there, Keto Mama. Yes, sucking your abs a little bit, just a little. Make it a habit. It should feel that it's abnormal for you to not be sucking in your abs a little bit. Because for most people with disc herniations, it feels weird for them to be sucking in their abs all day. But I want you to just do it so much that it feels weird not to. That's the place you want to live. Z Weird Adventure says, I'm the one with the sliding vertebrae. I love your content. Oh yeah, that's a spondylolisthesis where the vertebrae has slid forth. You got it. This same concept, by the way, is going to fit. My back pain program is designed to help all these conditions that I listed that were on the side of this slide here. The back spasms, SI joint dysfunctions. There's spondylolisthesis. That's the one where the vertebrae slips. Sciatica, disc herniation. All these 8 tracks, I built specific biases or extra instructions for the individual back problems, but I included it all in the same program because if you have one back problem, the likelihood of you having another back problem just starts to go up. And then by the time you get older, you're going to have multiple back problems if you've already had some when you were younger. And it just gets so convoluted and confusing as to, where do I start? What do I fix first? But I've simplified it here in the back pain program for you. Plus, I'll be doing weekly live group coaching calls with my team so that you don't get stuck. You keep going. All right, Mrs. Lewis says, this is where a lot of my issues come from. What about, are these recorded? Oh, so this live is recorded. It's available on YouTube and Facebook as well. Looks like you're on YouTube, Mrs. Lewis. So you can come back and see these again later on. Hi, Jay from UK. Hey, Jay. Thanks for joining us. Hummingbird 1967. Hi, Dr. David. Just to let you know that I decided to get knee surgery or shots because of your recommendations. Thank you so much. Okay, cool. Fantastic. Yeah, sometimes it's the right thing to do to get surgery or injections. And I think it's fine. I'm not 100% against it. I know I talk about avoiding surgery all the time. But I absolutely think there are cases where I can't help you and you need to go have a procedure done, or maybe it's right for you to get an injection because it's going to be the best thing for you moving forward. What I want to be a voice for is there's a lot of things that could be done to make the situation better naturally without having to get injections, medications, and very likely even avoid surgery altogether. We just don't want to jump to those procedures without doing some stuff that's going to help you out. And this stuff, by the way, just improves your quality of life. How much easier and more fun is life if you're stronger and fitter than if you're less strong, less fit, plus you have back pain and a looming pending surgery because your disc herniation just keeps getting worse. So let's do this all day. Z Weird Adventures, would the program be good for sliding vertebrae? Yes, I have a track for spondylolisthesis. It would be excellent for that condition. I've helped so many people in person fix that. Crazy story. I'll tell you this story. My first experience as a licensed physical therapist with a spondylolisthesis patient, I knew about it, learned about it in school, obviously. I had a lady come in. She had a baby 4 months prior to coming in to see me. I was a brand new therapist. I wasn't even a year out of school. And I was feeling her backbones, and I could feel the vertebrae. I was like, okay, there's L1, L2, L3. And I got to L4 and then L5. And I was like, oh my gosh, it's all the way in there. Like I have to go through a lot of tissue to get in there. And I thought this has got to be a spondylolisthesis where the vertebrae slid forward. So I asked her, have you had this checked out? Because she was having back pain. But she was a new mother. So she thought it's related to me being a first-time mom. This is what it's like after having a baby. And she had a bit of a difficult pregnancy. She had some back pain, obviously, during her pregnancy. So she just thought it was part of the process. So I told her, no, I think you actually have this bone shifted forward. But I told her, I need you to go get checked out by the doctor, because here in Texas, I can't send her to get an MRI myself or an x-ray. She has to go to another doctor first, and then they have to recommend it. She goes to the doctor. I tell her, it doesn't mean we can't see you. I just need to know that that's what's going on so that I can make sure to put you through the right rest of the treatment. She comes back. A couple days later, I get a phone call from the doctor, chewed me out, said, don't be telling my patients to go get an MRI. That's my responsibility. I said, I'm doing my due diligence. I want to make sure she's safe. He hung up the phone on me, so upset. I have a thick skin. I'm like, whatever. She comes back the next week and she says, I got the MRI, hands me the report, and it says right there, spondylolisthesis, the vertebrae slipping forward, L5, exactly what I had felt. And I said, great, this is what's going on. Now we know. She resumed treatment with me. She got so much better. I showed her a lot of this stuff. We got her abs to work. She didn't have a C-section, thankfully, but she was pregnant for almost a year prior to that, and so the muscles got all stretched out and weak. So we had to get them strong again after having the baby. And her biggest thing was when I go put the baby down in the crib and I have to lean over the wall of the crib after nursing, feeding the baby, she would get stuck. Her back would just lock up and she couldn't get straightened up and walk normal afterwards. But then as she got her abs stronger, she was able to bend over, put the baby down in the crib, holding a little weight, and then stand up and walk away just fine. But her biggest thing was she was planning on going back to work soon. And she said, I work in a fancy office and I love wearing my heels. I love showing off my high heels, and I have high heels, not high heels. I have these kind of high heels. And she said, I'm afraid to walk. And then the way my back is, I want to be able to get back to walking in those heels. And by the end of the treatment, she was back in her heels. She showed off her heels in the clinic one day. And I was like, those are pretty cool heels. I like those heels. She had a big closet full of shoes that she wanted to show off, and she got back to it just fine. I think you can wear heels if you have back problems. You just have to go through this so that you have enough strength to keep your balance on those beautiful shoes. Good little side story there. All right, let's go to the next one here. Mary Crow 7290. Hey, hi, I broke my pelvis at 37. So sorry. First total hip at 45, 4 hip surgeries, 2 totals. Now my knee is bad, meniscus, and herniated. I'm not sure the last part there. I'm so sorry, Mary Crow. That's tough. You got to get strong. Marcy Crow. Sorry, Marcy. You need to get strong. You need to get better abs and glutes, all this stuff. Because if you broke your pelvis bones, I guarantee you couldn't move your abs and glutes very well for a while until that healed. And going through all those surgeries, you probably were bedridden for a while here and there, or maybe you were active, but small amounts as you're recovering from surgery. You probably lost a lot of strength. So if you're done working with the doctors and the physical therapists that you may have seen, it's time to get going on stuff like this to make sure you can work your way through the right muscle activation to not have any imbalances, and then get to the more complicated movements as appropriate. Just be safe, please. What else we got here? Here's oh, I'm sorry, it was Melody, right? Let me get it right here. Yep, it was Melody. What if someone had 3 C-sections? How do you strengthen abs after this, especially when one is in menopause? So sorry, Melody. You just got to start from the beginning. Lower abdominal activation. I mean, think about it. That baby, those babies over the years, they stretch out the abs, and then because of the anatomy, just the shape of things, when your tummy's out here, it throws your balance off. Let's get the right camera angles here. Baby's here, you got the basketball in there, and then these back muscles back here have to just work extra hard to now keep you stable. That's why you see the waddle in the 3rd trimester of pregnancy, because you're trying to keep your balance with your back muscles as the baby's, you know, throwing you off balance here in the front. So ab muscles are just weakened. They're sacrificed each time you get pregnant. And if you didn't have any C-sections, then thank goodness. But if you did, they slice your abs open to get baby out safely for whatever reason you had to have the C-section. But, you know, hopefully everything heals normally after that. But it's highly likely that your poor lower abdominals haven't been activating properly since then. And you have to go through the process that I showed you on the table here, where you're pushing your back flat, getting your abs in, starting to do more ab work, doing the mini squats, making your abs work while you're standing, holding them while you're driving like I was doing across Texas. You need to figure this out, even if you had 3 babies, even if you had more babies. My wife, she's had 4, all naturally delivered. And she went through the whole thing, and she can rock out 100 sit-ups if she needs to, and she's doing them like I was doing them here. So she's got it. But it's very possible is what I'm saying. And even if you've had C-sections, you can still do this as long as your muscles are all connected normally, which sometimes there's problems with that. Hopefully yours are connected just fine. So there you go, Melody. Best of luck to you. Keto Mama says, thank you to the camera person. Aw. And then Marcy says, sorry, I think I have herniated disc. I'm so sorry. Yeah, I hope it gets better, Marcy. It's not surprising considering all the pelvis fracture, the surgeries you had, the replacements. You're going to develop muscle imbalances, which is going to put pressure on other parts of the body. The discs are one of those. That's how you can get a herniated disc. She says, thanks for the camera person. Awesome. Hi, Dr. David. Thank you for your help. Keto Mama says, I do everything you suggested for my bad knees, and I have seen a big improvement. I can squat fully. I engage my glutes easily now. Good job, Keto Mama. Fantastic. That's what it's about. I mean, this stuff works consistently. I'm looking at the body mechanics of the way that humans were designed. That's my training, my thinking, and I can't help but see it everywhere I go. I look at the anatomy that way. I'm not thinking medications. I am not a specialist in medications. I don't do surgery. That is just not my thing. I focus on movement. And so when I tell you, work out these muscles, not those, the imbalance works this way, that's where I'm coming from. So I know this stuff pretty well. That's why it works so consistently. So good job to you, Keto Mama, for applying this stuff. That's the hardest part, I think, is just trusting and applying, because you hear things from doctors like don't work out your back muscles, don't work out your back muscles, focus on that, or don't lift weights, don't pick up anything over your head. And it's such, I think the intent is just in the short term, while you're hurting, don't do that. That makes sense. But in the long term, once you're feeling better, you need to do it. You need to do it safely, though. And they can't teach you that because they may not know how to do it themselves. Sebastian is a member for us now. Fantastic. Hey, Sebastian, welcome to our channel here. Welcome to the community. Everybody give Sebastian a welcome. Just say welcome here in the chat. I'd appreciate that. All right, who's next here? We have Mrs. Lewis says, thank you. You're welcome. Mohammed says, hello, doctor. I am from Iraq. Awesome. I have a request. I bought a shoulder injury course, but I am suffering from the lack of translation feature on your site. Please add a translation feature into Arabic or other languages on the site. I am so sorry, Mohammed. Yeah, we don't have our programs translated yet. We're working on it right now. We have captions on all the videos, so I think your best bet is to check out the captions. Read it thoroughly, it's coming. With AI and all that, there's so many translation features that are popping up, and so we're slowly moving in that direction. So patience, Mohammed. It's coming. It's coming for sure. By the way, a lot of our YouTube videos now are in many languages. The ones that have been uploaded since about I think May or June, you can toggle the audio track, and all of a sudden I'm talking Spanish, I'm talking Japanese, I'm talking German. It's pretty cool. So for those of you guys that are all over the world, and if you have another language, check out our audio tracks and our YouTube videos. You'll be able to see more. Huff Christ says, I have 12 bulging discs from my skull to my sacrum. Jeez. Yeah, that's a genetic predisposition to having bulging discs, very likely. So you're the type of person that just needs to be doing this stuff like brushing your teeth. Like I can tell you from my teeth, I have a genetic predisposition to get cavities. It runs in my family, and my mom has it. One of my kids is dealing with it. Even though I brush regularly, I talk to the dentist about it. And I've gone through a lot, but I've just come to the realization that I just need to avoid eating certain foods, and I need to be brushing my teeth on a very consistent basis, which I do. And I've been able to mitigate that way. I still eventually get a cavity, but it's so much slower than before. But I just have accepted that. So in your case, with all the bulging discs in your spine, you just have to accept that's me. That's the way I'm built. I just need to know I need to work on my abs. I need to work on my glutes. And I need to do it on a consistent basis every week, like brushing and flossing your teeth, so that you can keep your spine healthy and you're not ending up in a situation where you need to have surgery. All right, let's keep going here. Oh, this is the same comment from Muhammad. He was on YouTube and on Facebook here. All right, we have Huff Christ says severe thoracic pain out to fingers. This is the same fellow that has all the bulging discs. Yeah, that's tough. Unweighting. I'm sorry, doing like the pull-up bar, like hanging, might be helpful for you. You might get to a place where there's an inversion table, or if you have access to a facility that has a traction table where you're lying down, it's pulling you apart. There's a motor on one side. You have harnesses attached to yourself where the motor's pulling and it's gently pulling your spine apart. That might be beneficial for you as well. At the end of the day, though, you likely need to fix the muscle imbalances, and that's going to be the way to fix a root problem. If you just keep getting traction or just doing hanging, it's not the whole solution. It's more of a short-term solution. Long-term is this stuff, because you keep the muscle strength, you keep it up, and it's constantly throughout the day while you're sleeping at night, while you're awake doing movements, doing your daily routine, you're normalizing the forces going through your spine so that you're not further herniating discs. All right, DDS says, which city? I'm in El Paso. I don't know where you are. Daryl Binns says, hi from California. Awesome. Mocha Java Black 4230 says, hello from Quebec, Canada. Awesome. My doctor tells me no amounts of exercise or diet can heal or reverse my low bone density problem. Is this true? I don't know if you have a specific condition that is affecting this, but bone density does respond to diet and exercise, very much so. Unless you have some specific condition that the doctor knows about that you're not communicating with me here, I'm not familiar with these conditions very well. You likely need to talk to your doctor about that. But if you don't have any special condition besides you just have osteoporosis, which is where you have low bone density, which puts you at higher risk for a fracture, then no, I would argue that you should be thinking about your diet and your exercising. You should be doing light weightlifting and working your way up to heavy weightlifting. Heavy for you, it's relative, because heavy for me might be very heavy for you, too heavy for you, or vice versa. Maybe you're a big guy and you're just a lot stronger than me. I have no idea, but you need to do something that challenges you within your capacity right now. And if that sounds like a lot for you, you probably need to start going through some routine like this that's going to take you months to complete, so that you can gradually improve strength in the right areas and then work your way up to where you're doing sit-ups, mini squats, adding a little bit of weight to your squat. Start out with the hand weights, and that should benefit you tremendously because you're going to increase the density. The body's designed to do that. It's called Wolff's Law. When you put the body under pressure, I'm pretty sure I have that right. Y'all fact check me if I'm wrong. But when the body responds to the loads that you put on it. That's the idea. Like muscles get stronger as you load them more, so do bones, so do tendons, so does cartilage, ligaments, skin, the heart muscle itself. A lot of your body is designed to respond this way. Bones as well. I think doctors say this sometimes because they don't see it happen. And I argue that they don't see it happen because they're not giving people the right advice. And so they're leading people the wrong way. And it's fulfilling their expectation of not seeing improvements because they're not giving people advice that truly improves them. So as a result, they take that observation as fact, and they say, well, you know, Joe tried to exercise and Mary tried to exercise and Fred tried to exercise, but they don't really know what they did and how much they exercise because they're not exercise specialists. They're medical doctors. And for all they know, they tried a set or two here and there, and it wasn't enough. And so then they're thinking, well, all these people exercised and their bone density didn't improve. And they all said they modified their diet, but did they really? Were you there? Did you track it very well? How certain were you? I don't take it as I don't agree. It just sits wrong with me because I feel like doctors aren't staying in their lane sometimes. And you know, they technically have you know, open lanes to everything. But what I would say is, if you're not truly an expert, like knowledgeable in the topic, don't talk about it. I'm not legally supposed to tell you medication advice. You know, I'll mention, like, there's some things that I can't talk about, like side effects. I can tell you that this is a side effect of that, but I can't tell you, yeah, you have this problem, take that medication. That's not my place. And I don't do that. And I always follow it up with, I'm not an expert in this stuff. But sometimes doctors are, you know, they think they know exercise and they don't. And I don't think it's their fault either, because I think some of them they're the only doctor in the area, and that's the only help some people are going to get. And so they're doing the best they can with what they know. But thankfully we have the internet, and you guys can talk to me from Canada or from wherever you are. What was the other country in town here? Iraq. We have California, all these different places. So you guys can get access to the experts, the best here in the world in avoiding surgery. All right, Lloyd Ann Hurd says, knee arthritis. It's mild, but I don't want it to get worse, from Alberta, Canada. Canada's always representing here. I love it. So sorry you have knee arthritis. Don't let it get worse. While it's mild, it's very manageable. Come on, you can do this. You can do this, Loy Ann Hurd. You need to get stronger in those glutes. This stuff, you could do this to probably get better in your knee arthritis. However, I'm telling people to get lower abdominal activation for the herniated disc problem. You need to focus on the glute activation, very, very likely, but abs are still going to be important for you. We got tons of videos on this. I did a video, I think, like 2 weeks ago on knee arthritis on a Tuesday for our live. So go check that out. I'm sure it'll be tons of help for you. And then we've also got our knee arthritis recovery program. Wisconsin Mom says, darn, I'm late. I'm still here with you, Wisconsin Mom. What question do you have? I'll keep going here. Z Weird Adventure says, awesome. Thank you. Call me Sarah. Oh, awesome. Hey, Sarah. Wisconsin Mom says, MRI yesterday. I'm 74, 3 herniated discs, 1 ruptured, plus spondylolisthesis, central canal, and foraminal stenosis. Oddly enough, no real back pain. All sciatica. PT is helping some. I can walk a mile. Awesome. Fantastic. Wisconsin Mom, you need to do this stuff that I'm talking about here on this video. Go back to the replay of this video and follow me and just do all this stuff that I said here. The first, like this whole section right here, 1 through 5, might take you a couple of months, maybe 3 or 4 months to do, somewhere like 2 to 4 months to do. Some people go faster, some people go slower. Then after 4 months or so, I would start hitting these 6, 7, and 8. This will probably take you another 2 to 4 months. And then after, so total, we're talking like, what is that? 4 to 8 months just to get from 1 to 8. That's a better part of a year. And then the last part of the year, the last 4 months of the year, maybe you can get to weights, depending on how fast you can go and how well you can progress this. But you should be able to execute a plan like this. And this is what this right here is a summary, a very loose summary of what's in our back pain recovery program, which we're releasing today. Go check it out. It's on our website, on our homepage. And you can get much more detailed guidance on this and get specific information about stenosis. I've got tracks on stenosis, sciatica, because they all overlap. You're the classic case of someone who's got everything going wrong in your back. You know, bone spurs are there, the discs are messed up, there's central stenosis, there's lateral stenosis, sciatica is happening, and then yet your back doesn't really hurt that much. Like, this is confusing for you to do, but you have sciatica problems, you got pain going down your leg. So the back pain program is excellent in your case. You should go check it out. Plus, you get to talk to me. I'll be able to see you on Zoom. We have these weekly live group coaching calls. My team can help you out too. We have a private community where my team's answering questions. You never get stuck in our programs. We always are quick to answer questions as much as possible. All right, next one here. Oh, look at that. There's a link for a back pain recovery program. There it is. So you can find the link right there and get straight to it. Z-Word Adventures. Oh, I'm sorry. What was your name again? Sarah. Hey, Sarah. I'm interested in what your thoughts are about supplements to help with back issues. Collagen, hyaluronic acid, perhaps. I don't have like a favorite supplement. There's a lot of supplements out there. I think supplements are good in general. Usually the glucosamine, hyaluronic acid, MSM, collagen, those like the classic joint supplements, I would tell people to start there. It's not going to hurt. What I don't want you to do though is only take the supplements and expect that to fix your back pain, because there's a muscle imbalance very often. I'd say every time. I've yet to meet somebody who has a back problem. I've never met somebody ever in my life who has back pain, and I checked out their muscles and I'm like, oh wow, you look good. Like there's no problems as far as muscles go. I'm wrong. I've never seen that. I've only seen consistent ab weakness, consistent glute weakness, consistent back muscle dominance, hip flexor dominance, and then people being told to never lift weights because of their back pain. That's what I consistently see. And I recommend the opposite. This has to be done right. That's what I showed you here. So I'm all for take the supplements, as long as you don't have any allergies and it's something you can afford to do and you're into doing, because not everybody's into it. Not everybody can afford it. Finish the whole bottle, by the way. Don't just say, I took it for a day or two and didn't help, or it did help. Like that's not enough time. You need to finish the bottle. It needs to build up in your system. But there's still bad pressures going through your back, and you need to fix it with this. The supplements help get the right components, hopefully, to the areas that need it. But you still need to fix the mechanics. That's what we're doing here. So hopefully that helps, Sarah. I think you should try. I take a ton of supplements, by the way. I take like 14 or 15 pills, like supplements, vitamins and supplements every day for different reasons. I'm not sick. I don't have an issue. It's for my own health. Sarah says, great story, gives me hope. All right, we got a little bit more here. Zorro Bravo 2000 says, hello, what about shrinking disc? Needs to be operated. I do try to strengthen the muscle around the waist, abs, sides, and core muscles. It helps to feel good, but I still need to know if operation is a must for a shrinking disc. So shrinking disc, you're probably talking about degenerative disc disease. It's right here. Let me get that a little bit closer. Degenerative disc disease, it's kind of together with arthritis and stenosis. And this tends to happen here when people are in their 50s and beyond. And you might also have a disc herniation or sciatica at this age. Usually you stop having spondylolisthesis because the spine stiffens, you get arthritis. And then back spasms, they can still happen, but they're not as often. But when you have that shrinking disc, the degenerative disc disease, the loss of disc height, it's because of chronic back muscles squashing the disc. So you need to fix the imbalance. And if you're doing all that, great. I would not proceed in having surgery unless you have some persistent pain. So let me show you this image here. Hopefully you guys can all see that. Let me get rid of the comment here. So I got this from the Mayo Foundation. And you're looking at the spine right there. There's a herniated disc and it's pushing on a nerve. And this is a little bit of central and foraminal stenosis combined, central and lateral stenosis. So what we're looking at here in the top picture, I don't know if you guys can see my cursor, but the top picture, it's a slice and it's pushing into the nerves. It's pushing the spinal cord over to the side. If you have a loss in disc height, you might pinch the side nerves too because of the space. Let me show you on my model here. This might be better here. So there's the nerve on the side right there. And if the red is the disc, if the disc is being squashed, the hole where the nerve comes out starts to shrink down, and that's called stenosis, and you start to pinch the nerve. You might live with that pain-free, but if you had an MRI or an X-ray where they showed you this stuff, that gets burned in your mind, And every time you have pain, you're thinking, oh, my nerve's getting pinched. When most of the time, I think a lot of pain that people have is associated with the imbalance because your back muscles are overcompensated. They're being used too much. And the back muscles themselves are just hurting from being used too much. I mean, just think about it. If I give you a weight, I got weights here. If I give you this weight and I said, hold this weight for the next 8 hours, and you can't straighten out your elbow, you have to keep it bent like this. You could probably do it for a little while, but after the first hour, after the fourth hour, by the end of the 8 hours, your arm's going to be hurting because it's been holding up this weight. That's what your back muscles are doing. They've been holding up your balance all day. They're hurting. How do you know with certainty? Nobody does, by the way, with certainty that it's truly that pinched nerve or the disc. That's where your pain is coming from. This is connected to, what was the comment over here? Wisconsin mom. She says she has no back pain, but she feels a pain in her leg. That's the only way that I say that you can know that you're having a true pinched nerve, because the pain is going down your leg, or you have a muscle strength loss in your leg. That's, for me, and I think most doctors out there would say the same thing, that's definitive nerve pinching symptom. But pain in your back, it could be the nerve, it could be the muscles. I think it's often the muscles. Could be the nerve, could be the disc itself, could be the bones, the joints. There's a lot of sources of pain. We don't know definitively what the source of pain is, though, from an MRI or from an examination. It's hard to pinpoint it. So I don't know when it's right to have surgery is my short answer. It could be, I wouldn't have surgery unless you have pain going down your leg or loss of strength in your leg. Hope that helps you. All right, let's take one more question here. We got Wisconsin mom says, welcome, Sebastian. Oh, congratulating and welcoming our new member. Hey, Sebastian. David Ekpin says, what are your thoughts on acupuncture treatment? I'm for it. I think it's cool. No surgery, no medications. They might offer some supplements, some herbal stuff. I think that's great. And I've seen excellent success. I have referred patients that have severe sciatica pain. And I mean, severe sciatica pain. They don't want to be on medications, on muscle relaxers. I'll say, go to acupuncture, and they have a massive improvement. It's not fixing the muscle imbalance. It's not fixing the mechanics. It's mitigating the pain, though. And that might be good to keep you, still conscious, because muscle relaxers, they can put you out. They tell you don't operate heavy machinery. You probably, if you have a very thoughtful job, you probably won't be able to do it if you're on muscle relaxers. You're going to want to just sleep. So it's almost a trade-off of if I take this pill, I'm just going to sleep all day. And yeah, I have less pain. I'm just kind of waiting this out. But what if you need to work? What if you need to take care of people? What if you're a parent, you need to take care of your kids, or you're an adult and you need to take care of your aging parents that need help? You don't want to be on muscle relaxers all day. It's just not a fun life. So try the acupuncture. I'd say go give it a shot. Find one near you that works. All right, I think I got time for one more. Hi, Dr. David. This is Hummingbird 1967. I'm sorry I messed up my message. I didn't have knee surgery or shots. My phone auto-corrected the message. I got well of my knees with your recommendations. Okay, so earlier you said that you ended up having surgery and shots, and I was saying sometimes it's needed. Which is still true, but you're telling me here that you didn't need it because you did our stuff. That's fantastic. Even better news. I'm so glad that you did not have surgery and did not have shots, and that you were able to get better with our recommendations. That is so cool. Fantastic. All right, guys, I got to get going. Pleasure being with you guys. One of my favorite times of the week. I love doing these. I'll see you guys sometime next week as well. Thanks for joining me. Bye.